We're looking at 2 points now, gallbladder 34 and stomach 36. And these 2 points are very close together, and sometimes people needle one when they think they're actually needling the other. So let's have a good look at these. To find our stomach 36, we can start with the knee straight and we find the lateral infrapatellar sulcus. The easiest way to find that is just to pass your fingers over the patella and they'll naturally fall into the 2 hollows either side of the patella itself. The point lies 3 chun down and 1 chun across from the crest of the tibia. So it's right into the upper third of the tibialis anterior muscle. Now, the second point that we're going to use is gallbladder 34, and it helps to flex the knee on this one. What we do is we're going to find the head of the fibula, but to find the head of the fibula we can slide our finger up the bone and then we're coming towards the most prominent point on that bone. If we don't slide the finger, if we come from the knee down, often you find you hit the tibial tubercle and it's sometimes difficult to dissociate between the two. So once we found our head of the fibula, we go obliquely forwards and downwards by 1 chun. So if we take our gallbladder 34 and our stomach 36, you can see that these 2 points only lie apart by 1 chun. So we'll start by needling our stomach 36 point, and we needle with the knee flexed and supported, so where we've got our pillow here, we can turn our pillow round, and that way we've got an adequate amount of flexion in the supported position. We'll use a medium needle, and where we want to mark the point, what we can do is use a guide tube from a previous needle, and then I'm finding my lateral infrapatellar sulcus, go down by 3 chun, 1 chun across from the crest of the tibia, and then I can mark that point and I'm left with a small little circle. So I know exactly where I'm going to needle, and then I'm coming, placing the needle onto the skin, tap to break through the skin surface rapidly, and then the insertion is by 1 chun and we're perpendicular to the skin. Now, when we come perpendicular to the skin, we're avoiding the vessels themselves which lie between the tibia and the fibula. So we'll withdraw this needle and pop that into the sharp spin. For our gallbladder 34, we're finding our head of the fibula and we're coming forwards and downwards. So the finger comes onto the fibula shaft towards the head, forwards and down, and then we strike the needle. So this point is a powerful, important point, said to be the influential point for muscle and tendon, whereas our stomach 36 is a powerful point which is often used linked with large intestine 4 and liver 3 in the foot to form the 6 Gates points typically used for pain reduction. So we'll withdraw that needle, gallbladder 34, we're on the medial channels of the leg now, and the inner face channels are called the yin channels, and we're on the spleen channel, which is coming from the inner surface of the toe and the foot and onto the inner surface of the shin. And the first point we're going to do is spleen 6, and spleen 6 lies 3 chun from the apex of the medial malleolus, and we palpate that area, and then we press our finger down to move into a gap between the bone and the underlying tissue. Now, on some subjects, you find that the weight of the calf and the Achilles squishes the muscle onto the bone, and if that's the case, then what we will do is lift the calf up so that the heel is hanging free, and then we've got a more palpable gap. So for spleen 6, we're using a medium needle, and our insertion depth is up to 1 chon. So we can insert the needle perpendicularly to the skin and then stimulate. So apex of the malleolus, come up by 3 chon, press into the hollow between the bone and the muscles. Strike the needle and then stimulate. So at this point, all 3 of the yin channels meet. So this is a crossing point for our spleen, our liver and our kidney channels, and all 3 channels are used in women's health conditions, and so this point is said to have a powerful influence on menstruation. So it's worthwhile just warning your patient, female patients, that their menstrual cycle may be interrupted. So we can stimulate that point, and as we come to withdraw the needle, we're using our Q-tip to press the skin in one direction and pull the needle in the opposite direction. So that's our spleen 6 point. Coming further down, we're coming to the inner ankle, and we have 2 eyes of the ankle. On the inside, we're going to needle spleen 5, and on the outside, the equivalent point would be gallbladder 40. And to find this spleen point, we've got 2 different methods. The first is to take a straight edge from beneath the malleolus and a straight edge from above the malleolus, and where those 2 points meet, that is our spleen 5. The second method is to take the pad of your thumb, place that on the sharpest point of the malleolus, and your thumb tip points towards the tip itself. So we're going to needle that with a small 13 or 15 mil needle. And if we needle perpendicularly, it goes in by 0.3 to 0.5 chon. If we needle obliquely, we can go from 0.5 up to 1 chon. So we withdraw the needle, find the point, orientating in this case with the thumb, place the needle on, strike the needle, and the needle has to be in sufficiently for it to stand up. So in this particular case, it is standing up, so that's the depth that I need. If it isn't standing, then I'm going to just press slightly further in from my 0.3 to my 0.5 chon. So that's the inner eye of the ankle, which is our spleen 5 point. Withdraw the needle, pop it into the sharps bin, and just check the skin surface for any remaining spots of blood. So we're on to a yin channel, an inner face channel of the lower limb, and in this case we're on the liver channel, and we're using liver 3, which is a powerful point, and the 2 points liver 3 on either side go with the large intestine 4 point in the upper limb to form the 4 gates points. To find this point, the easiest method is to slide your finger up between the first and second toe until it rests in a natural hollow just towards the top of the cleft of the 2 bones. We're going to needle with a small needle, 13 to 15 mil, and it can be a perpendicular insertion up to a depth of 1 chon. And I would expect a strong de qi sensation from this point because it is a powerful point. So slide the finger up. You can keep your finger in that position. Tube goes on the distal portion from your finger, and then we stimulate until we feel the de qi sensation. So we're coming into our liver 3. Press the skin down as we withdraw the needle. The needle goes into our sharps box. We're looking at the front of the thigh now, and we're looking at anterior pain in the hip or pain travelling from the anterior hip down the front of the thigh. And we're on the stomach channel itself. So we have needle stomach 36, and the channel is coming from the centre of the inguinal crease at our stomach 31, and then comes inwards towards the abdomen. So we're needling our stomach 31 point, and the surface marking for this is a straight line from the anterior superior iliac spine downwards, from the most prominent part of the greater trochanter and across. Now that level is also the level of the superior border of the pubic symphysis, which is our conception vessel 2 point. And this point is needled below the level of the inguinal crease and slightly lateral to the sartorius. So there's a very shallow dip in that area. So we're right away from the neurovascular bundle which passes under the inguinal ligament. So we're away from our femoral vessels. So anterior superior iliac spine, take one line downwards. From our greater trochanter, take the line across. Move the limb slightly to locate the sartorius so that your finger naturally rests into a hollow lateral to the sartorius. We're going to needle to a depth either perpendicularly 1 chun or obliquely up to 1.5 chun. Strike the needle and then advance it. If we go in an oblique insertion, we can go towards the distal portion of the channel. So we'll stimulate the needle, and in Chinese medicine this is often called a gateway point for energies moving into the limb. So although we're using it for anterior hip pain, it may also be used for low back pain of femoral nerve referral type. So as we withdraw the needle, press the skin in one direction, pull the needle in the opposite direction. Just to ensure there's no spot of blood, we've got a cotton wool bud or a Q-tip there to compress. Stomach 31. We're on to the bladder line now, and the bladder line comes down through the centre of the posterior knee at bladder 40, bladder 57 towards the centre of the calf, and the point we're concerned with is bladder 40, which lies between the malleolus and the Achilles tendon. Now, where the weight of the limb pushes down, it moves the Achilles tendon closer to the underlying bone, so we're going to put the limb up onto a towel, and that way the Achilles is moved back and we can now see this natural sulcus, the Kager triangle. So we're going from the highest point, the most superficial point of our malleolus, and we're coming back into the hollow area. The needle is going to go in and slightly upwards towards the medial malleolus. So we're going to use a medium or small needle, depending on whether we choose a perpendicular insertion, which would be 0.5 chun, or an oblique insertion, which can be up to 1 chun. So onto the apex of the malleolus, find the level of the Achilles, come into the flattened triangle area, strike the needle, and then aiming towards the medial malleolus, so we're coming upwards. And this can be through needled to the point on the opposite side, which is kidney 3. And by through needling, I mean that both needles go to their maximum depth. So the needles don't touch, but they go to their maximum depth on either side. So that is our bladder 40, bladder 60 point close to the lateral malleolus. Just remove the needle and make sure there's no spot of blood. So we're on to bladder 40 now. And bladder 40 is a point on the back of the knee. We have two bladder lines, an inner and an outer bladder line. And the two lines come down and they actually join on the back of the knee. So the point itself lies close to the popliteal vessels. So to ensure safety, we're going to bend the knee and place the foot up onto a pillow. And the description of the point, traditional description of the point, is on the back of the knee between the two tendons. Now, our subject just lifts the foot up. When we can see these tendons tightening, we can see we're between the biceps femoris on the outside, the semitendinosus on the inside. We're going to place our needle between these two, so it's slightly lateral to the center of the popliteal fossa, which is where our neurovascular bundle is lying. So we take our medium needle, and insertion depth is going to be 1 chun perpendicular. Strike the needle, press it to its depth. If we need to go deeper to 1.5 chun, then we would angle our needle either downwards towards the foot or upwards towards the ischial tuberosity. So that's our bladder 40, can be used for posterior knee pain, but most commonly used for low back pain referred into the posterior thigh, so sciatic type pain. Bladder 40, and we'll withdraw the needle, making sure that our fingers are away from the needle as it comes out.